Hi, I'm Amanda Ralph, a nurse practitioner and the owner of White Coat Aesthetics here in Las Vegas, Nevada. Today, I thought it would be a good idea to go over some of the risks associated with Botox. This is going to be great for new injectors and also clients who are potentially looking at starting Botox for the first time. Let's talk Botox in general. Botox, we inject it, you go home, it's like nothing happened, starts to kick in around day 2 to 3 and can really we see the results at 2 weeks. In general, your most common side effects are going to be bruising, potential bruising, and potentially some inflammation at the area. You may feel tender at the site of injection. There may be some redness. And these are all very typical side effects that you may or may not see with injected treatment. I don't usually get anything that bad. I have done Botox multiple times at this point. What I really see most commonly is going to be that potential bruising. And the bruising risk, in my opinion, is highest right here around the eyes because you have a lot of little capillaries that are hard to see. And so I would just say, as an injector, be very, very careful of injecting around this eye area. Pull the skin really tight and really make sure you've cleaned all makeup off of the skin so that you can see as much as possible when it comes to the little tiny capillaries. Now let's talk about the more serious risks that patients always ask me about. In general, I want you guys to understand Botox is not reversible. So when we inject Botox, the outcome that happens, whether it is wanted or unwanted, is going to stick with us for some time until the nerve terminals start to resprout and then the actual muscle movement starts to return. The more risky areas to inject would be right here above the eyelid and this area above the eyebrow. And let's talk about what those risks are. The first one I want to talk about is the drooped eyelid. A drooped eyelid is also referred to as eyelid ptosis, which is the muscle here affected, which then doesn't allow the eyelid to actually open the way that it normally would. What is happening here is that the product injected here along the corrugator to stop the frown somehow travels or hits the nerve under here that then relaxes the entire eyelid muscle. For me, I do a few things to attempt to avoid this. I grab the lateral tail of the corrugator and I also inject just very superficially into that tail to attempt fluid from not going into that eyelid area. I also like a really tight reconstitution of fluid so that it doesn't allow for a lot of spread in this area as well. So what happens if we get an eyelid ptosis? There's a few things you can try. One being some sort of an eye drop, iopidine. I know Upneek is very popular to attempt to try and open the eye area. I've also heard more recently that you can inject saline into this area to try and clear through some of that Botox. Ultimately, it will go away. This is not a permanent issue at all. It's just going to be very uncomfortable for a few weeks. Now let's talk about eyebrow drooping. Eyebrow drooping, although it's a little different than the eyelid drooping because really the eyelid, we are hitting something we did not want to hit at all. With the eyebrow drooping, it's really a matter of getting too close to that eyebrow, not allowing the natural movement of the eyebrow. Some people are more likely to get this feeling if you raise your eyebrows and you have very, very deep wrinkles all the way touching the eyebrow. Then as an injector, we're in kind of a difficult spot because the closer we go to the eyebrow, the more likely we are to make the eyebrow feel heavy. But if we don't go too close, then we're not knocking out those wrinkles that are very close to the eyebrow. So this is something I'm always educating my client on. What I like to do is be a little bit more conservative on the first time that I treat them and then bring them back at 2 weeks. If I need to bring just the tiniest bit of Botox right above the eyebrow to relax the wrinkle, I can do that. But I would like to see what I can accomplish in the first pass, just staying higher on the forehead. I want to give you some information about why this happens. So Botox is a muscle relaxer, a temporary paralytic to the muscle. Our frontalis muscle helps us raise our eyebrow, okay? It helps us raise it. So if we inject Botox in this area, we are then lowering the eyebrow. If we inject too close, then you have very little room to actually raise the eyebrow, and that's going to be your dropped eyebrow. So it's a matter of dosage, it's a matter of placement, it's also a matter of what the client wants. I have clients that come to me that are like, I want to be totally frozen. And then I have clients who are like, I really want to be as natural as possible. I don't want anyone to know this. And these are things that you can adjust with your dosaging. So just be aware of that as a client. Yes, eyebrow dropping is a risk, but it's also related to your wrinkle presentation on your forehead. Now let's talk about around the eyes. I do like to discuss this as well, that there is a risk of knocking out your true smile by overdosing the crow's feet area. So when I smile, naturally I bring some wrinkle to this area. If we totally knock out any of my ability to do that, it's going to make your smile look a little bizarre when you are doing this treatment. I always try to explain this to people because at a point, you want a little bit of wrinkle so that you can continue to look normal, in my opinion. If you do not care what you look like when you smile and you just want to knock it out, we can do that. But I am very, very, very conservative around the eyes when it comes to weddings, when it comes to any event that you have where you're going to be taking pictures. I want you to look and remain normal to yourself. And so part of that is not completely knocking out those crow's feet, or else I'm going to knock out your true smile as well. And there is kind of a fine line on what is going to help you look normal. For me, I remember one time I did mine heavier and then we got family pictures, and I just remember thinking something looked a little off about my smile. I'm not sure that anyone else noticed it, but I did, and ever since then I'm very conservative about treating the crow's feet. Other than that, in general with lower face, basically the biggest risk with Botox is going to be hitting a muscle you didn't intend to hit. And although we can have as much education as possible about muscles and anatomy, we cannot see through the skin, and we cannot perfectly predict exactly how your muscles are going to present. One risk when it comes to masseters that I've seen is that if you do not hit the masseter properly, you can get kind of a bulge on the masseter when someone clenches where you didn't hit it. So then that one little section of the masseter bulges out more than it should. Another risk, if you do not hit the masseter properly, is bringing the product up and hitting what is called the risorius or the modiolus muscle, which allows you to smile. So if you hit this improperly and you knock out that smile, then they won't be able to pull their smile all the way laterally. And for that, unfortunately, it is also just time, maybe flushing some saline through it, but ultimately you're going to have to be more careful with that patient. Same thing when it comes to this DAO muscle, the muscle that does the downturn of the smile that allows you to frown. If you hit this improperly or product moves to another area, the patient accidentally massages the product, it can hit the DLI, which allows the lip to come down when you smile. And if you hit this on accident, then when the patient smiles, this side of the face will be up and they can't do a true smile. With this one in particular, the DLI, if someone accidentally hits that, what you can do is knock out the other side to then allow for just the symmetric movement of the mouth while they're waiting to regain their normal smile function. In any of these cases, if I have any sort of accidental paralyzation of a muscle, then what I will do is I will go in and inject saline to that area. What I will say, these risks are very, very rare. I have personally been injecting 8 years, and I have had one case of any of this, and it was a DLI being hit. It's really rare, but it is an unfortunate potential for these things. For me, my rule of thumb, though, is treat the patient how you would want to be treated in any of these situations. If this were to happen to you, you would be extremely frustrated. You would be very, very embarrassed. So I take extra special care with any of these patients that may be experiencing something like this. I bring them in as soon as they mention it. I've also had multiple times where someone calls in and it sounds like they might have an issue. I bring them in and they're totally fine. But just treat everyone like it is happening. Bring them in, make sure that they feel like they are being taken care of. And I personally always offer them a discount on their next treatment. You don't have to do that. Obviously, these are potential risks, and I do educate my patients about this. But to me, it would be frustrating for that to happen, and I want them to trust me in moving forward. So something that I offer. Let me know if you have any questions about potential risks for Botox in the comments below. And one last clarification I want to make, these risks are the same when it comes to Botox, Dysport, Jeuveau, Xeomin, any sort of neurotoxin on the market. I just use Botox most frequently, so that's why I use that phrase. But again, thank you for watching, and let me know if you have any other questions.